I guess we can start. Good morning, everyone, and welcome to the fifth seminar of this Super Spreader seminar series. Before we proceed further, we would like to acknowledge that the offices of the OMNI network are built on the lands of various indigenous communities whose history precedes that of York University and the OMNI network. A little introduction about this Super Spreader seminar series. This is a seminar series that is part of the OMNI network, and it's basically a platform for the postdocs, students, and other highly qualified personnel to promote their work, share their work, and hopefully build some networks within the bigger network. So without further ado, I would like to introduce the speaker today. So today, Dr. Jeta Molla will be presenting her work. She is a postdoc at the York University, and before that, she was at the Aalto University, and she has been working on various aspects of epidemiological modeling of infectious diseases. Her PhD was based on modeling of lithium-ion batteries and numerical simulation of the stochastic wave equation. And today she will be presenting her work that she's currently doing at the York University. And without further ado, I would like to welcome Dr. Jeta Molla.
Thank you for the introduction. So I guess I can start and share my screen. Okay, great. I can share my screen. Okay, oops. Thank you. Guess I need to put here. Okay, and so hello everyone. So the main objective of my project and of my study during as a postdoc at York University has been to basically model human behavior and incorporate the effects of human behavior in epidemic modeling. But I would say in today, the presentation, the main focus is going to be about the effect of when individuals do not comply with social distancing measure or NPIs, and also there is like the anti-vaccine sentiment, so when they do not take vaccine. So, I cannot go to my, sorry, yeah, why does it move? So for motivation is why human behavior is important is because since the start of the pandemic, when the pandemic first started, of course, the control for the disease, the governments, the first thing they employed is NPIs, because there were no vaccination, of course, in the beginning, and which included lockdowns or closure of businesses, closure of schools. And even when the vaccines became available, it took some time until to even discuss about removing NPIs. And but both these public health measures, both when it comes to NPIs and vaccination programs, let's say the success of these measures depend on how much individual will apply. So first, the government, let's say, will suggest that, or will even impose, let's say, national lockdown, and say that individuals need to reduce their contacts. But that's not necessary that everyone will follow those measures. So it is important to incorporate that dynamic behavior and the effect of human compliance. And then for the other is, especially for the COVID-19 pandemic, which lasted for a very long time, in the beginning, it was a new virus, and then individuals, the risk perception for the virus was very high. But as time was evolving, even though the risk perception might be high, but because of pandemic fatigue, because of so long measures are prolonged, then individuals still might not, their willingness to comply might change. And the other important feature when it comes to modeling is that if you have individuals, even a percent of individuals who reduce their contacts, that affects the disease dynamics. But of course, their behavior is affected of how the disease spread. Let's say if the disease is in the exponential phase, when the number of cases increases very fast, or when, let's say, the number of cases is the reported number of cases is very high, then they might follow a more protective behavior during that time. And then if, let's say, when the number of cases decrease, they will still follow social distancing, but they might not follow it fully. So they still might start to resume normal life. So in terms of modeling, where we employ the compartmental model to describe the spread of the disease, where we have the following compartments, which is susceptible, and individuals in the susceptible class, if they come into contact with an infectious individual, then they contract the disease and they proceed to the exposed class, where in the exposed class, individuals have contracted the virus, but they still cannot transmit it and they haven't shown symptoms. And after the exposed period, individuals proceed to the pre-symptomatic class, where they can transmit the virus, but they still haven't developed symptoms. And then after the pre-symptomatic period, the individuals either will continue to not show symptoms, but they are still infectious, so they go to the asymptomatic infectious, or they will show symptoms and of course still be infectious and proceed to the symptomatic infectious. But in our model, we also take into account testing, so individuals in the pre-symptomatic, infectious, symptomatic or asymptomatic infectious might get tested and they proceed to the tested compartments, which we use the subscript capital M. An important feature about this class, individuals about the tested classes, is that they fully isolate. That means if someone gets tested and test positive, then they will reduce their contacts. They do not make any contacts, the zero contacts. So that means also that they do not contribute to the spread of the disease. We also take into account hospitalization, and make the assumption that only individuals who show symptoms will go to the hospital, and then all the individuals from the infectious classes, they will recover after some time. But we also include the effect of waning immunity. So individuals who got the virus, they recovered, now they have immunity which they gained from infection. But of course, that immunity after some time wanes, and let's say after, this is a parameter which you can vary, and then after some time, individuals will again, the recovered individuals will again go to the susceptible compartment, which means they have no protection from the virus. So that is for how the disease spread. But for social distancing is basically, by social distancing means individuals will decrease their contacts, right? And then in our model, we have 3 different social distancing classes to kind of show, let's say, in the zero social distancing class, individuals behave normal, right? Normal meaning there is no reduction in contacts. They will make contacts as usual. But then the next social distancing class, the social distancing class 1, individuals will reduce their contacts, but they will reduce their contacts only by a factor. And then, of course, individual can go from 0 to 1, but also they can socially relax. So they can go from 1 to 0. And then we have the social distancing class 2, which this is the class in which individuals fully isolate. They do not make, again, any contacts. 0 contacts for individuals in this class. And again, individuals can transition from 1 to 2, but also they can go back from 2 to 1. So we have a dynamic behavior. We don't only assume that individuals reduce their contacts, but also we have a relaxation function in which individuals, they might actually go to less social distancing classes. And for our model, all the compartments transition among these different social distancing classes. So we have the disease progression, we have incorporated social distancing, but another feature we are interested in our model is vaccination. And in the model, an imperfect vaccine, by an imperfect vaccine means that individuals will get vaccinated, but not all of them will gain immunity. So individuals who get vaccinated and they gain protection from the vaccine, then they proceed to these compartments, where this calligraphic S basically includes all the compartments that get vaccinated, but only the compartments, the infectious symptomatic and the testing compartment individuals do not get vaccinated. And then if they got vaccinated, but they did not gain immunity from the vaccine, then they proceed to the susceptible, they proceed to these compartments here, which again, here this is calligraphic SW includes all the compartments that get vaccinated. Before I discussed about how in the recovered individuals that who had disease-induced immunity, they lose that immunity after some time. So we also model the waning immunity that individuals gain from vaccination. So after some time, the protection that they gain from vaccine wanes, and then they go to the compartment, which they are vaccinated, but they don't have any immunity. And then the next, we have a third type of immunity. And of course, because we are modeling human behavior. And this, the third type of immunity is the perceived induced immunity. What do we mean by that? Is that you have individuals who have got vaccinated, but they don't know if they gain protection or not. And they will behave because they say, oh, I got vaccinated, so they will behave as they have protection. And that basically is a variable in the social distancing function. So that means that they social distance less in a way because they think they are protected. But that will wane, that perceived induced immunity will wane after some time. So let's say after 6 months, well, what you see in the media, right, what you read that from the studies that come out, immunity wanes after, let's say 6 months or 7 months. So then they start like, oh, it's been 6 months since I got vaccinated, so probably I don't have protection anymore. But okay, I presented the model and the case in which all individuals they comply with social distancing, they get the vaccine. But what if there is a percentage of population that does not want to get the vaccine? So in that case, we have two now models. So what models? There is one model, but we have this class of individuals, which is a percentage, which could be 5%, could be 10. You can vary. We vary that in our study. So we have this side in which 1%, this P percentage of individuals, they do not get the vaccine, but okay, they don't like the vaccine, but they are like, I will not get it, but I will social distance. And they go among all the different social distancing classes. And then the other percentage, like 1 minus P, which let's say if you had 20% of the population doesn't receive the vaccine, then the 80% receive the vaccine and they fully social distance. So this is one scenario which we investigate. So what if, let's say, a percent of the population does not want to get the vaccine, but okay, they will comply with social distancing at least. Then the next scenario is, okay, what if they get the vaccine, they do get the vaccine, but they do not social distance. They do not want to fully social distance, or they can't fully social distance, right? Let's say because of their job. Let's say when you have healthcare workers, even if they will get vaccinated, but they don't have they cannot really reduce their contacts. They still, because of their job, they need to come into contact with people. So they can't go to the social distancing class 2, meaning to fully isolate. So this is another scenario to investigate. So we kind of go through different scenarios of what if a percentage of the population receives the vaccine, what if they don't receive it, but what if they receive it and they do not fully comply with social distancing. And then another scenario is even worse, even when you have individuals who they do not get the vaccine, but they also do not social distance. So here they go only up to social distancing class 1, but we also look at the case in which you have a percentage of individuals where they do nothing. They don't social distance, they don't get vaccinated, but again, it's just a percentage of them. The other percentage, let's say if you have 20%, the 80% will follow social distancing and will get vaccinated. So when it comes to, we have 3 social distancing classes, but how do individuals go from, let's say, social distancing class 0 to social distancing class 1? Well, for that, we have this social distancing function, which basically determines or induces social distancing. Based on the values of these individuals go from social distancing class 0 to social distancing class 1. So this function, the 2 main quantities that are we have to note is first this Km, where this is basically the doubling rate of the disease. So let's say when the disease might not, let's in the beginning, right? In the beginning of the pandemic, maybe the number of cases was not very high, but the disease was in the exponential phase. And their individuals might be more prophylactic, might be more vigilant. They're like, okay, the cases might not be very high, but the disease is growing, so I should be more careful with my contacts. So in that case, this is the doubling rate. And if the doubling rate is based on the critical value of this doubling rate, which we basically estimate that will induce social distancing. But then the other quantity is the number of cases, right? The individuals will react to that. If the media report, let's say 50,000 cases today, or today, hopefully not anymore, but in the past, that means this will induce social distancing. And all this KM and MA, the doubling rate and the number of active cases, we have them changing in time, of course, because it comes from our simulation. And this is, so then the social distancing keep varying in time. The individuals, depending on what phase the disease is or how the number of cases are, they will transition to more social distancing classes. So then, as I mentioned before, when it comes to the doubling rate, which induces, so the value of the doubling rate that induces social distancing, or the number of active cases, we do estimate these two parameters, but we also estimate the testing rate. So this is basically, of course, that will give us the number of reported cases, and individuals react to that. So that affects the behavior of individuals. And also we estimate the vaccination rate, which of course also is it's a pharmaceutical intervention, but even this will affect the behavior of individuals. And we also have the hospitalization rate, because we wanted our hospitalizations to fit to the data. And we use, of course, data from Public Health Ontario, and we use data on total active cases, on daily active cases, on the total vaccines that were administered in Ontario, and we also use data on current hospitalization. So when it comes to estimation, we estimate our parameters from March 10 to December 31, 2021. But in this case, we do not just have fixed parameters. We do estimate the parameters at different time windows. Let's say the first time window is from 10th March until April 14th. But how do you choose those time windows, right? You can't choose them. If you choose them arbitrarily, then you can't really say anything about, especially the parameters that are related to human behavior, or the parameters that affect how individuals will social distance. So we choose these time windows according, let's say, to the policies that were implemented during this time period. Let's say when we had a national lockdown, for how long that national lockdown lasted, that is the time window that we choose, because individuals will, when there is a national lockdown, that will affect how people will behave. And if then the lockdown is lifted and the measures start to, let's say, relax, then also that will affect the behavior of individuals. So then as I said, when it came to the models, I presented some different scenarios. So like, what if a percentage of individuals does not get vaccinated, or what if 1% gets vaccinated, but they don't follow social distancing? So we investigate basically 6 different scenarios. So the first scenario is we use this D2V. So in this case, here individuals do everything. All of them, they social distance and they get the vaccine. But then basically in this case is like the number, as we see D2V. The 2 means that the number indicates up to which social distancing class they go. And then the V indicates if they get vaccinated or not. So I will see here, D2V, I said, is the scenario in which individuals do everything. And then D2 is the scenario in which they do social distance. They go up to social distance class 2, but they don't get vaccinated. And then we keep decreasing. We keep decreasing how much the social distance. Then we say, okay, they go only up to social distance class 1, and they get vaccinated. And then they go up to social distance class 1, but they don't get vaccinated. And then, of course, is the worst scenario in which, if let's say we have a percentage of population that does nothing, which means they don't get the vaccine and they don't social distance. They never reduce their contact. So the first results is, now we're going to look through some different results, and basically the main objectives, of course, to look the impact of these different scenarios, like when, let's say, a percentage of population does not comply with social distancing measures, or they do not get the vaccine. But the first is the fitting results. So here I'm presenting only the, as I said, I'm fitting to different data set, but the main reason I'm presenting the daily active cases. I will showing the next plot is because, so first we see that, of course, the active cases, they do fit pretty good to the data up to this time period. But after that, the fit doesn't look that great. So we see that the fourth wave, the actual fourth wave was here, but this predicts the timing of the fourth wave is further away. And also it's not like a full fourth wave. But of course, this is basically close to when the Omicron variant started. So that's why we also stopped our simulations before the Omicron variant, because of how uncertain and how difficult it was to get the fitting there. So and even the behavior individuals changed a lot after that, because it was the Omicron variant, vaccination were high, cases were high. So we stopped basically before the Omicron variant. And then, although then when we look at the daily active cases, the fit might not look that great during this time period, but when we look to the total active cases, the fit is pretty good. But then, what if we remove waning immunity? What if we assume that individuals, if someone got infected, then they gain protection from the virus that is permanent, like they will never get the virus again, or the vaccination gave you protection forever. You never get the virus again. So what we see here, no matter the fit looks again pretty good, and it's almost the same of what we saw before. But then when it came to this time period, no matter what time windows we would choose, let's say even if you choose a 7 days time window or a 2 weeks time window, this we could not capture the fourth wave. So this here, you see that is because we chose even like small time windows, still nothing could start to show that there is an increase in number of cases here. And especially after that, here you see it almost goes to 0. And that basically indicates that after like some time, if as the disease keep evolving, if the individual gain permanent immunity, that means that there are not enough susceptibles after some time for the disease to spread. Okay, so now we will look at some different scenarios for when we have, let's say, 5% of individuals who do not get vaccinated or do not social distance, or all the different scenarios or all the different cases, and 20%. Again, recall, as I said, these are the different scenarios, D2V, D1V, and the number indicates up to which social distancing class they go. And then the V variable indicates if they got vaccinated or not. So also note that the vaccination started around this time. Well, it started around there, but the number of vaccinations there was very low. So that's why when it comes to looking at the different scenarios when, let's say, between D2 and D2V, the difference there is like, let's say for D2, only 5% of the individuals do not get vaccinated. And we don't see much difference between those two scenarios. And that is because up to this time, vaccination started here. But of course, really the vaccinations there was a spike in vaccination. It was much later. And until we see the effect, this takes some time. And of course, again, recall that this is for the case only when it's only 5% that do not receive the vaccine. But we do see an effect, of course, when percentage of individuals does not comply with social distancing. And although here we do see an effect, but it's not that much different. It's not like a huge difference, right? But what if then we have 20% of individuals that do not social distance and they do not take the vaccine? Well, in that case, as we see here, it is way more in a wave here, especially the second wave lasts longer, peak is much higher, so way more daily active cases than the baseline scenario when individuals do everything, like the individuals follow social distance, they get vaccinated. So the next plot is we show the impact on the total on the cumulative, basically active cases. And then here, again, for the 5%, there is difference. Of course, there is difference, but the biggest difference is when 20% of individuals, let's say in this case, in the scenario D0, do not social distance, they do nothing. When even 20%, right? Even when, of course, it's not a small percentage, but still, 20% of individuals, when they do not social distance or they do not take the vaccine, we see a huge difference. We see like here, probably it was like the numbers, but it is the difference is very big. And then here we see the bar plots for the total active cases, but for different percentages, like what if 5% of individuals, 10%, 15, or 20 for these different, again, scenarios. And as expected, the scenario that is the worst, which is good, that the modeling shows that which indicates how important is to follow social distancing, is so no matter the case, 5%, 10%, or up to 20%, the worst scenario is the zero scenario. Of course, when you have only 5%, right? When you have only 5% that does not get the vaccine, let's say between D0V and D0, we do not see much difference between them. But as this percentage increases, we see the difference increasing also in the number of total active cases. And then, which is again a good thing, the best case, the best scenario, like the best thing to do is to follow social distance and to get vaccinated, because we see here that the best case scenario is always the baseline scenario, no matter what, no matter 5% or 20%. And then the next result concerns the impact of hospitalizations. So in this case, again, we do the same. So we look at the 5%, what if 5% does not comply with measures or does not get the vaccine, or 20%. So for the 5%, again, it's not that big the difference. But then for the 20%, again, we see a huge difference in the number of hospitalizations, and that hospitalizations are also a very important metric, because that basically, that affects the healthcare burden. So one thing that we also knew during the COVID-19 pandemic is how much the hospitals were overflown in some countries, and we basically want as much as we can to minimize the number of hospitalizations, have the list of them. And then the next plot is basically here, we present the number of total hospitalizations for different time periods. But these time periods are basically, let's say, the way we calculate it, we choose the time is basically corresponds to how the time, or the time for each wave in Canada was chosen from Public Health Ontario. So for the first time period, we see again the expected. If you don't social distance, then you do not follow, like if this 20% does not follow social distancing, then this is the worst scenario. And here, surprisingly, that if you look only at the first time period, we see basically that partially social distancing is the best, it's not the worst. Well, then when you go to the second time period, that's not really a good indication, because we see that here the numbers are, here's tens of thousands of difference. So the baseline scenario in which is, again, when individuals comply with measures, then we see here that this is way less hospitalization than the other scenarios. The worst scenario, again, is when percentage of the individuals do not do anything. But here again, for these time periods, we do not see any difference between the scenario in which individuals get vaccinated or no, but that is again because first vaccination hadn't even started in this time period. And then we go to the third time period. And here, again, surprisingly, we would expect that the worst scenario is the scenario in which that percentage of individuals do not do nothing. But that we see that basically here now, the worst scenario, the worst case is when you partially follow social distancing. And that can be basically explained in a way, because let's say that up to time period 2, the disease spread so much for the scenario in which individuals do nothing, that then enough individuals gain natural immunity from getting infected. So then for this time period, they are not enough susceptible to get vaccinated, and this scenario to be the worst. And then again, for the last time period, for the fourth time period, the worst scenario is still the scenario of partially social distancing. So then again, this is because as we saw in the time plots, in the previous plot, we see here that the disease spread so much for the case in which individuals do not social distance for the D0, that then we see here that basically the peak for the scenario in which individuals partial social distance is larger than the scenario of when this is for the third basically wave. So in conclusion, I would say the main outcome of the study has been that waning immunity. So it is, when it comes to modeling, it's really important to include waning immunity so that we can capture multiple waves. And then the good thing that the results indicate is that even when that percentage, even like that 20% or even like 15% of individuals do not follow the measures, do not follow social distancing, or they don't get vaccinated, then we see that basically that has a huge impact on the number of hospitalizations, on the number of cases. So it is really important that social distancing and vaccinations are implemented and individuals comply with those measures. Then, of course, we want to extend our study in order during the Omicron variant, because so far we only investigate the time period from March 2020, and then we stopped before the Omicron variant. And then in the end, the main goal or the main focus of our study is basically to investigate human behavior, how human behavior changes during a crisis. And of course, then it would be really important and it's crucial to develop those human behavior models like following psychological theory, which predicts or models or describes how individuals change their behavior during a health crisis. Thank you.
Awesome. Thank you so much for presenting your work, Jeta. And at this point, I would like to ask if there are any questions for Jeta.
Right.
Yeah, I'm gonna ask a question then. And I'm actually glad that at the end you said in the future of work you will be incorporating more human psychology in the models.
Yeah.
I was also wondering if you can, or just as a suggestion or thought process, incorporate some of the cultural aspects into the modeling.
Yeah.
Also.
Yeah.
Because there were some behaviors which are like there was an outbreak of measles in Minnesota, and it was linked to behavior at a more social level than at an individual level. So I was wondering if you were thinking of incorporating some of those aspects into your models.
Yeah, I mean, when you refer to psychological theories, so indeed it's so like you can't really say much, but indeed that's a very important feature, that the social structures, right, how individuals in different social structures behave. So that's why, like, when in our case, of course, we have this dynamic social distancing function, but it would be nice to know that what does affect the compliance of individuals, what does affect their behavior, right? To how, and that's also, it's affected a lot of from the different classes, from the different social structures in the society. So it is really like, that's why we are interested to kind of study and try to incorporate more how psychological theory like predicts in a way or describes how individuals behave during that, which is not homogeneous, right? Because in our case, the behavior is homogeneous. But as exactly what you said, that it is not only can be affected by that too.
Awesome. So we have a question here. Azade, I think.
Yes. Hi, and hello everyone, and thank you, Jeta, for your nice talk. I was wondering when in the slide that you showed the impact of total hospitalization.
Yes.
There was to me it seems that D2V, whereas D2 it shows that the vaccination didn't contribute that much in order to lower the number of people who get hospitalized.
Yes, yeah, like you mean like even for the time, of course we see the impact of the time period 4, because that's when basically vaccination had started, right? But of course the first thing to take into account is like only 20%, right? When this is not like the whole population in D2, it's only when 20% of individuals do not take the vaccine. And the other thing that which I also discussed is that is up to this time period, because we don't really see so much the effect of vaccination, because the number of vaccinations, of course, had increased at that time, but until enough individuals get vaccinated, so you need to go further in time to really see the impact of vaccination. So it's two factors: the fact that, of course, it's only 20%, but also the time period, because of when vaccination started and when did they start to basically spike.
Okay, and also I have another question. By 20%, you mean that only 20% of the total eligible population got vaccinated?
Yes, no, only 20% did not get vaccinated, and 80% gets vaccinated.
Okay, so actually my question was that, so we have the data on vaccination. I mean, I couldn't figure out what was the necessity to assume, for example, 80% of people admitted and got received the vaccination. However, we have the daily data on the total number of people who got vaccinated.
Yes, we do have, but it's not necessary that, you know, we know that basically the vaccination coverage was not 100%, right? And still, what we kind of we preliminary to kind of model is the anti-vaccine sentiment, right? You do have the data, but that is basically the number of vaccinations. But there is no, like in the data, how can I say? Maybe now there are data, but for the data that we use is basically tells you the number of vaccinations. But in the general population, not everyone was very willing to get vaccinated. So that's what we want to include, like though that percentage, but that percentage, we don't know it. So that's why we vary it. We do 5%, 20%, 15%, or 30%. So that's what basically that we want to incorporate, the willingness to get vaccinated.
Oh, yeah. Thank you so much.
Thank you.
Awesome. I think Joseph has a question.
Hi, Jeta. Thank you for the talk. Yes, I have this question. I think I'm not clear on this. With the same slide where you have time periods, like, so my question is most like a follow-up with what was just asked. I was thinking D2V didn't contribute much in the first time period. And
yeah,
then
but
then second time period, D2V was good. So I'm wondering, like, what are you capturing as the time period, like the different time periods? Is it when vaccination was first implemented to a certain point and then to different...
no, the setting point basically is from how the time in time, the, like, how can I say, the waves, each wave, let's say the time of the first wave, how the Public Health Ontario is determining it, or how they like when you go to Public Health Ontario, they tell you, let's say from March 10 until, let's say, June 10, that when the period of the first wave was. And then from June 10 until December, let's say 10, this is the time period for the second wave. But I don't call them here wave 1, wave 2, because for each scenario, the number, like the timing of wave changes. Like if you go, like if I go here, you see like the number of, like where the second wave, well, it's not really well defined for D0. That's why I call them all time periods, because the wave for each scenario, the timing of the wave changes.
Right. Okay. Thank you.
So if there are no more questions, I would like to thank Jeta once again, and I would also like to thank all of you for being here, and happy holidays and have a great new year.
Thank you.